Hi, everybody. Good afternoon, and thank you for joining the Justice and Mental Health Collaboration Program 2015 Grant Application Assistance Webinar. The JMHCP program is a very important initiative to help reduce the prevalence of individuals with mental illness that are in our criminal justice system and to promote further collaborations between organizations in both the criminal justice and mental health systems. After presentations by Danica Binkley from the Bureau of Justice Assistance, Jerry Murphy and myself, Cynthia Kimmelman-DeVries from the Council of State Governments Justice Center, there will be time for a question and answer session. To ask a question, please type the question into the Q&A panel on the bottom right-hand corner of your screen. We'll do our best to answer your question. If your question does not get answered during the webinar, please do follow up via email after the event has ended. At the end of the presentation, we will provide email addresses for everybody speaking today. If you encounter technical or audio problems during this webinar, please call WebEx Technical Support at 1-866-229-3239, 1-866-229-3239. Please understand that there are some technical issues you may not be able to resolve. For this reason, we are recording this event today and will be emailing the recording out to all of the attendees as well as posting it on our website shortly. I'd now like to turn things over to Danica from the Bureau of Justice Assistance.
Thank you, Cynthia. Good afternoon. My name is Danica Binkley, as Cynthia stated. I am the Senior Policy Advisor for Health and and Justice at the Bureau of Justice Assistance. And I work closely with my associate, Maria Fryer, who is the policy advisor who oversees the Justice and Mental Health Collaboration Program and will be also working with any and all of the upcoming FY15 grantees. I'd like to start by just welcoming you all and thank you for coming and for your interest today on our webinar. The Justice and Mental Health Collaboration Program has been in existence since 2006 and is really geared towards creating and sustaining the types of collaborations between criminal justice and behavioral health treatment providers that can greater respond to the needs in the community, ranging at all points of intercept at the criminal justice system. Today I'm going to walk you through a little bit about the solicitation and go through each of the components, targeting all of the essential criteria, the eligibility, the target population, grant categories, performance measures, as well as the essential components of the application, including the program narrative, budget, and other attachments that are necessary to apply. And then we'll be moving on to talk about the grants management system, which is BJA's system in which we receive, process, and manage your grant awards, and then move on to additional information and resources for you. So, again, to reiterate, the overview of the Justice and Mental Health Collaboration Program is that it really is here to help increase public safety through innovative cross-system collaboration for those individuals with mental illness who might find themselves in contact with the criminal justice system. And that does also include those with co-occurring mental health and substance use disorders. This program is authorized by the Mentally Ill Offender Treatment and Crime Reduction Act, which is actually currently up for reauthorization now. Next slide. Thank you. Some of the programmatic uses for Justice and Mental Health Collaboration Funds include providing appropriate services for system-involved individuals with mental illness, specialized training programs for criminal justice and mental health personnel, improving law enforcement strategies responding to individuals with mental illness, making diversion options available such as mental health courts, alternative prosecution and sentencing programs, pretrial services, and other court-based programs, as well as providing transitional services for those with mental illness who are incarcerated or reentering the community from a correctional institution. As I stated, really this program does cover the entire spectrum of the criminal justice system, starting with first contact with law enforcement, moving all the way through reentry back into communities. Here on your screen is the link for the fiscal year 2015 solicitation. Feel free to go to our website, which is bja.gov. You can also access it by clicking on the funding tab. So I'm going to start moving through the solicitation at this point and going through key components. I do understand it is a long document. I do encourage you, though, to try and read it cover to cover if you are going to apply for this program. I imagine that a lot of your questions will be answered in the text of the solicitation, although it is easy to overlook some of those critical pieces, so I'll really do my best to walk you through it today. So starting with eligibility. This is we get a lot of questions on this category or on this criteria, and I want to spend a little bit of time going through eligibility. So applicants are limited to states, units of local government, federally recognized tribes, and tribal organizations. So what that means is it can be any state, local, or tribal agency, and that can also include if the mental health provider is going to be the applicant, if the mental health provider is not a government agency but is the designated mental health provider for the county, you can still be eligible to be the primary applicant. So you're either a unit of local government, and that can be any unit, including any aspect of the criminal justice system, or the mental health provider who is designated as the county provider for that county. So each applicant must demonstrate that the project will be administered jointly between justice or juvenile justice and mental health. So only one agency is going to be the primary applicant here, and those I just went over must be the state, local, or tribal organization. Next slide. So a criminal or juvenile justice agency is defined as an agency of state or local government that is responsible for detection, arrest, enforcement, prosecution, defense, adjudication, incarceration, probation, or parole relating to the violation of criminal laws of that state or local government. So this is in the solicitation, this definition, which is in the authorizing legislation, but it does go over sort of what I just spelled out in terms of all of the different aspects of the criminal justice system being able to apply, being eligible to be the primary applicant. A mental health agency is an agency of state or local government or its contracted agency that is responsible for mental health services or co-occurring mental health and substance use services. So again, I get a lot of questions on this. I just want to reiterate, even if you are not a local or state agency, if you are designated as the provider for local or state government, you would qualify for the purposes of being the primary applicant for this award. That is to say, too, if you are not designated as serving that function and you're a mental health provider and you still want to be involved with this grant program, you are more than welcome to still partner with our criminal justice applicants. It just means that you can't be the primary provider for these purposes for applying for these funds. Next slide. So the target population that we are looking to serve through the use of these funds includes both adults and juveniles who have been diagnosed with a mental illness or co-occurring mental health and substance use disorder, has faced, are facing, or could face criminal charges for a misdemeanor or felony that is a non-violent offense. And it's important to note that an individual's past criminal history has no effect on present eligibility for JMHCP programs. What's more important than the past criminal history is the current charges or offense that is bringing the individual into contact with the justice system for purposes of participating in the program in question. Next slide. Applicants should not work with a substance use population only. JMHCP funds are intended for use with a population with mental disorders only or co-occurring mental and substance use disorders. So that mental illness component is really important for these for the use of these funds. So justification must be included for selecting the target population, including providing data on the needs of the target population. And the total number of individuals the project expects to serve during the grant period must also be provided. Next slide. Next slide.
Danica, you should see it on your screen. It should say Category 1, Collaborative County Approaches.
Oh, that's not moving forward for me. Unfortunately, it's still stuck on target population.
I see that actually. It looks like.
Okay, there we go. Okay,
on
to Category 1. So this year we are soliciting a new category of funding under the Justice and Mental Health Collaboration Program, and that is the Collaborative County Approaches category. We're looking to make awards for up to $150,000 for up to 24 months. And what this award will do will allow counties to look at their own systems and support a targeted analysis of the prevalence of people with mental disorders in the local jails and a review of existing community resources and identification and initial implementation of policy and practice changes to minimize contact or deeper involvement of these individuals in the criminal justice system. And I'll just say a few words about this, but I do know that our partners at the Council of State Government Justice Center will be talking more about the kind of assistance that they will be providing for this category of grantees in the future. But this really grew out of some of the efforts that we have undertaken with CSG to provide assistance to some localities, some counties, in looking at their systems and trying to figure out where there may be bottlenecks in the system. So for example, if you're finding that your jail may be housing individuals with mental illness for much longer periods than the rest of the general population, this might be something of interest to you. What you can do is apply for these funds to really take a deep dive and provide an analysis of what exactly is going on in figuring out the root causes of some of these inequalities. So again, CSG will be talking more about this a little bit later in the presentation, but that's just a general introduction, and we can answer your questions about this later as well. Next slide. So Category 2, Planning and Implementation. You may recall, if you've been an applicant in past years, that there was a separate planning category exclusively. We have since eliminated that category and simply now have the planning and implementation category. We've just found that over the years we've been getting fewer and fewer applicants for the planning category as more and more programs get underway. And this category really does subsume both together in one. So there's still a planning component here. You have the option of coming in for up to $250,000 for a period of up to 36 months, and this does include a planning period at the beginning of your award where you will complete a planning and implementation guide that includes your strategic plan for your project, and then you will move into the implementation phase. Next slide. And then Category 3 expansion. This has not changed from past years. Funding amount available is $200,000. The project period is 24 months. And Category 3 applicants will really look to expand their current projects. So whether that be adding some kind of new component or looking to expand the target population or some other aspect of an already existing program, that's generally what we see under the expansion category. Next slide. So allowable uses. I'm just going to go over a little bit here. There's some really detailed information in the solicitation about allowable uses, and that even is not an exhaustive list of what we've put in the solicitation, but we really did try and give a little bit more information this year about the types of allowable uses that you can expect for Categories 2 and 3, especially the planning and implementation and expansion grants, which both have similar allowable uses. So law enforcement responses, which is a priority consideration, this is where we're looking to increase the number of grantees in this category who are providing, whether it be training, whether it be specialized receiving or diversion centers, developing or enhancing computerized information systems, or developing or expanding law enforcement mental health programs such as co-responder programs or CIT programs for responding to incidents involving people with mental disorders or co-occurring substance use disorders. All of the whole spectrum of law enforcement type responses, programs, trainings, resources, that encompasses this entire use. And you'll find some detailed information about law enforcement responses on page 6 of the solicitation. So training for criminal justice, mental health, and substance use treatment personnel. This really does cross over the whole spectrum of the criminal justice system. And this is looking at training programs that offer either cross-training or any kind of specialized training programs for whether it be correction staff, court personnel, community supervision, community-based mental health and substance use providers. The opportunities are endless. And again, this is on page 6 and page 7 if you're interested in exploring this category a little bit more. Enhancing access to community-based healthcare services and coverage. This is a really big priority for us this year and in general. So we're really talking about utilizing funds to implement strategies for increasing access to healthcare, including behavioral health treatment for populations that are anticipated to reduce recidivism and costs associated with detention and incarceration. So looking at strengthening partnerships between criminal justice, health, behavioral health, and all of the different types of benefit programs, including not only healthcare coverage such as Medicaid or local healthcare providers, but also looking at the navigators and health insurance marketplaces, the regional veterans integrated service networks, locally federally qualified health centers, and other public health departments to really look at better ways to connect individuals to care and enroll people in coverage. So this includes that whole span of activities, not only getting folks connected to coverage, but also, like I said, providing them access to care in the community and making sure those meaningful linkages are made once the individual returns from the justice system to the community. So moving on to community supervision strategies, this is on page 7 of the solicitation, really looking at different ways to incorporate more evidence-based practices into community supervision, which includes looking at criminogenic risks and needs, and really incorporating that into case management and different community supervision strategies. Diversion and alternative sentencing. Again, this is really looking at mental health courts or other specialized court programs or any other types of diversion or alternative to incarceration programs that can divert the individual from the justice system. And more information can be read about this on page 8 of the solicitation. And last, case management and direct services. So really looking at connecting individuals to evidence-based practices. And again, this is similar to the community supervision strategies, but looking at how to really connect an individual's criminogenic risks and needs to the care that they're receiving. So providing that kind of holistic case management and connection to direct services, which may also include making sure that the individual is receiving referrals to community services such as housing, education, that sort of those sorts of services, as well as making sure that evidence-based treatment is being delivered as part of the case management, such as access to CBT and those sorts of evidence-based therapies. So moving on to the next slide. So moving on to performance measures. So this year we put links in the solicitation to the complete list of performance measures. And these are really important because all applicants must provide data, must respond to the performance measures. But not all of these performance measures will apply to everyone. So if you want to go online and look at the complete list of the performance measures for both categories, that is included here as well as in the solicitation. Next slide. So I'm just going to go over a little bit what needs to be included in your application. So the application for assistance, the SF-424, that will be automatically generated when you go through the application process, inputting your information. The program abstract, this is really important. This provides a summary for your project and key information that we need to have quick access to, so make sure not to forget about the program abstract when submitting your application. The program narrative, totally essential to laying out all of the important details of your application. The budget worksheet and budget narrative, also there's some very specific references for both of these in the solicitation, including a sample worksheet that I would refer you to for more information on the budget piece. And know that you can also combine these two. The budget worksheet and narrative can be one document if you do provide narrative responses in the worksheet as well. The indirect cost rate agreement, the tribal authorizing resolution if necessary, if applicable, applicant disclosure of high-risk status. If you know you're in the high-risk status category, you are required to disclose that information. And last, project timeline and MOU, as well as letters of support and additional attachments. So I encourage you, there's a checklist at the very end of this solicitation. Just make sure that you are meeting all of these extra attachments as well. So we really want to make sure that you have an effective timeline as well as those letters of support that show that your collaboration is firmly in place. So from all of the different partners in your application, that you've got those letters of support, as well as there are a few other additional attachments that are just part of the standard application process that are in the checklist that I, again, encourage you to refer to. Next slide. So going through the program narrative. So we're going to take these a little closer look at some of these that are really key to the application. So the program narrative must respond to the selection criteria that's listed on pages 28 to 31 of the solicitation. And it's really important that you do actually follow the guidance here on the format, double space, standard 12-point font, 1-inch margins, number of the pages, etc. Because if you don't follow these, the format requirements, you actually can be docked in the peer review process. So we just want to make sure that everybody is on equal footing with their formatting so that everyone has the same amount of space to include information on their program. Next slide. So looking at the budget, again, I said there is a sample worksheet that you can refer to. This is really important. I just want to bring your attention to one detail. So for all applicants, we do include information that you must include funding to support up to 4 staff to come to a 2-day grantee orientation meeting in Washington. And although in the solicitation it says up to 4 staff, we really strongly encourage you to budget for 4 staff members. And part of the reason that we do that is because we've got some breakout sessions divided by discipline. So it's really important that there be somebody to attend the session on, the financial management aspect of your award, as well as the other substantive breakouts that reflect the different, mental health as well as the criminal justice systems. So it's really important that you have as many, 3 or 4 at least, to attend at the orientation event in Washington. And for categories 2 and 3, also this should include the national meeting as well. So that's at least 2 staff for a 3-day meeting in Washington, D.C. And this year, for fiscal year 2015, both events will take place in fiscal year 2015. So you can include that in year 1 of your budget. Category 2 and 3 applicants must set aside at least 5% of the budget in order to implement a data collection plan. So the plan should be described in the program narrative under selection criteria 6. So again, refer to your solicitation for more information about this. Next slide. Match requirement. So for all applicants, you need to include the amount and source of the match of funding in the budget. The federal funds awarded under this program may not cover more than 80% of the total cost of the project being funded. The applicant must identify the source of 20% non-federal portion of the total project cost and how match funds will be used. So refer to page 15 in the solicitation for more information about match. And this can be in kind or cash. Next slide. So here, I know I've been referring to this. Here's the link where you can find the sample budget worksheet as well as the OJP financial guide, but both of these links are also in the solicitation. So other attachments, I mentioned the project time and task plan. This is really important, looking at the goals, objectives, activities, and expression completion dates, as well as who is responsible for completing these tasks. Memoranda of understanding or letters of support. Again, these are from the co-applicants and collaborative partners, as well as applicant disclosure of pending applications. So if you have requested federal funding, if you've requested funding from additional sources, be that federal or non-federal, you must disclose that in your application as part of this application process. Next slide. So the application must be submitted through grants.gov. You'll want to make sure that you're registered with grants.gov as soon as possible, as sometimes the registration process can take some time, as well as make sure that you've got a DUNS number, and you can do that by going online or calling this number. So these are things that you'll want to do ASAP. Because they can take some time, and you just don't want to wait until the last minute to register and make sure you have that DUNS number if you don't have that already. Next slide. So applicants also need to be up to date on their CCR information, as well as knowing their taxpayer ID or EIN number. Applicants who don't have an EIN number should apply immediately. According to the IRS, when applying for an EIN number over the phone or internet, you'll be given a temporary number, but your EIN may not become active for up to 2 weeks. So again, this is one of those tasks you'll want to complete immediately if you don't have an EIN number yet. Grants.gov Help. This is really important. Again, this is all in the solicitation, but I just want to bring your attention to the Grants.gov customer support hotline. That's available 24 hours a day, 7 days a week, except federal holidays. But again, we really do encourage you to access the system early and often. So as well as sign up for notifications regarding the solicitation. So if something happens or it's modified in some way, if you sign up with grants.gov for email updates, you'll be notified about any of those changes. So additional important information. So I will say that I believe that we do actually have a budget. We're not operating under continuing resolution. I think the slide just did not get updated. I believe that we do have final budget numbers, but we don't know yet how many awards we will be able to make because we don't have those final numbers, but we do have an appropriation. So the deadline for submission is April 14th by 11:59 p.m. And we strongly encourage you to submit those applications well in advance of the deadline. So in addition to how long it can take sometimes for grants.gov, for the DUNS number, for EIN, there can also be some unforeseen challenges in the process. And we get a lot of folks who try and submit their applications just seconds or minutes before the deadline, and inevitably there are a lot of problems. Sometimes your system may freeze, sometimes the grants.gov system may freeze. There can be a whole host of issues that can come up that can easily be avoided if you don't wait until the last minute. So we really, really, really strongly encourage you to get your application well in advance of the deadline, at least a couple days if you're able. It makes everybody's lives a lot easier and a lot less stressful. Next slide. So here are some links that will be very helpful in preparing your application. Obviously, the link for the solicitation. As I stated, it has all of the critical information that you need in there, and I encourage you to read it from front to back. I know that it's a long solicitation, but there's a lot of details that a lot of folks overlook in preparing their applications that are really critical. So I encourage you to go through that with a fine-tooth comb when submitting your application. So information on JMHCP, there's a link to our website about the program specifically. And there's also a link for the BJA Grant Writing Manual. This can be also very helpful in preparing applications. I would encourage you to visit that, as well as CSG's Justice Center website. They have a lot of resources, a lot of publications. I know in the solicitation we've linked to a couple of them that specifically spell out different law enforcement strategies. Although they have resources and publications on all kinds of different mental health justice collaborations, including there's a whole curriculum on mental health courts, a lot of different resources spanning the whole justice system. So if you have not been to CSG's website yet, I really, really strongly encourage you, even if you do not apply for this opportunity, there are wonderful resources on justice and mental health and different aspects that I would strongly encourage you to visit and consider. And for questions regarding the solicitation, there is a BJA Justice Information Center that is set up to take your questions either via phone or email, or you can also live chat with them as well. So they are standing by and prepared to answer your questions. They are only open, though, through the hours of 8:30 to 5 Eastern Time, Monday through Friday, and they will be open from 8:30 to 8 p.m. Eastern Time on the solicitation close date. So I'm now going to turn it back over to Jerry and Cynthia at the Justice Center, and we'll be able to answer questions for you at the end of the presentation.
Thanks so much, Danica. Good afternoon, everyone. My name is Jerry Murphy, and I'm the Director of Training and Technical Assistance in the Council of State Governments Justice Center. CSG, or the Council of State Governments, was founded in 1933. It's the nation's only organization serving all three branches of state government. CSG is a nonprofit, nonpartisan membership association that fosters the exchange of insights and ideas to help state officials shape public policy. This offers unparalleled regional, national, and international opportunities to network, develop leaders, collaborate, and create problem-solving partnerships. CSG focuses on a multitude of public policy challenges, and the Justice Center is the criminal justice arm of CSG. The Justice Center provides practical, nonpartisan advice and evidence-based, consensus-driven strategies to increase public safety and strengthen communities. We are fundamentally an organization that focuses on providing training and technical assistance to Bureau of Justice Assistance grant recipients, to states, and to other criminal justice and behavioral health organizations. And we have three major project areas. that we focus on a daily basis. One of them is our behavioral health program, which really deals very much with the JMHCP program. And in our behavioral health program, we promote collaboration among criminal justice and mental health organizations to improve responses to individuals with mental disorders who are in contact with the criminal justice and/or behavioral health systems. And we do that by working with organizations by providing them targeted training and technical assistance. Specifically, we work on almost a daily basis with grantees of JMHCP grants. We produce newsletters, monthly webinars, conferences, policy papers, and publications, all focused on criminal justice behavioral health issues. The second major project that we work on is our National Reentry Resource Center. And the mission of the National Reentry Resource Center is to advance the reentry field by providing a one-stop, interactive source of current, evidence-based, and user-friendly reentry information. Through the NRRC, as we call it, we also provide individualized, targeted technical assistance for Second Chance Act grantees. And we provide training, distance learning, and knowledge development to support grantees and advance the reentry field. Our third major program area is called Justice Reinvestment. And Justice Reinvestment is a data-driven approach to improve public safety, reduce corrections and related criminal justice spending, and reinvest those savings in strategies that can decrease crime and reduce recidivism. We work with states around the country to identify the drivers of spiraling costs and to develop practical solutions to reduce those costs while ensuring public safety. That's just a quick overview of the Justice Center. To learn more about the work that we do at the Justice Center, and specifically in our Behavioral Health Criminal Justice Program area, please go to our website, which is CSG Justice Center. Again, it's csgjusticecenter.org/mental health. At this point, I would like to turn it over to Cynthia, who's part of our policy staff here in the Behavioral Health Program, to provide more information.
Thanks so much, Jerry. Hi, everyone. My name is Cynthia Kimmelman-DeVries, and I'm here representing a team of technical assistance coordinators who work in the Justice Center's Behavioral Health Project. We're here to provide you assistance to cover the course of your grant under the JMHCP program. Before we start our question and answer session, we'd like to give you a short introduction and overview of the Council of State Governments Justice Center and what resources will be available to you should you be awarded a JMHCP grant. As Jerry mentioned, and on your screen now is an example of our main mental health page. I urge you to take a look at the website, sign up for the newsletter, which you can do by navigating to the subscribe link in the upper right-hand corner of any page, and explore the vast number of resources it contains for you to get information. Once applications are accepted by BJA and awards made, we work with BJA to assign you a technical assistance coordinator. Your TA coordinator will work with you over the course of your grant and can do a number of things for you. Off-site technical assistance includes regular phone calls, check-ins, and emails we will have with you and your key stakeholders or partners, usually on a monthly basis. We also have resources to conduct a limited number of in-person visits to those grantees that have a situation that could benefit from an in-person consultation by Justice Center staff and a content expert. Another thing we do is connect you with resources such as research findings and practical tools, and experts such as researchers and practitioners who can help you resolve challenges you face in meeting your goals. Through the multiple technical assistance programs we manage, we're also able to connect you to individuals and programs that are in your shoes right now, or people who are implementing programs similar to yours. Our National Criminal Justice Initiatives map, the link on your screen, is accessible to you now on our website and before you apply, and allows you to search by programs funded not only under JMHCP and the Second Chance Act grant programs that we work with, but other grant programs funded by the Department of Justice, Labor, Education, and Health and Human Services. In addition to the resources I've just mentioned, the Justice Center website has a vast library of written research documents, practitioner's guides, as well as distance learning opportunities, some of which are displayed on your screen right now. All of these documents are free and downloadable from our website. We also conduct a series of webinars over the course of the year, one approximately every month on topics that have been requested by JMHCP grantees. There's also an archive of previously conducted webinars on a variety of topics that can be found on our website under the Resources heading and can be viewed at any time. And lastly, once you're awarded a grant, all JMHCP grantees are invited to an orientation and conference, usually in the spring, in the Washington, D.C. area. This is an excellent and important event. Experts from the field will be presenting. There will be work sessions conducted by Justice Center staff as well as national speakers. You will have the opportunity to meet with your technical assistance coordinator in person, staff from the Bureau of Justice Assistance, and network with your peers from around the country. I hope that this has been helpful in giving you examples of what technical assistance looks like from the Justice Center, as well as examples of things you can expect once you receive a grant award. At the end of the presentation, we will display all of our contact information. Please feel free to email the appropriate person for additional information, either the BJA staff for more fiscal and grant-related management issues, or either myself or Jerry Murphy as it pertains to technical assistance issues. As a reminder, we will be emailing out these slides shortly, as well as posting a link to the recording on our webinar page in an archive format. We're now going to begin the Q&A answer session. To ask a question, please type the question into the Q&A panel, which is on the bottom right-hand side of your screen. I'm going to be moderating the questions coming in from participants, and we'll do our best to answer as many of your questions as possible in the time remaining. Again, if we run out of time, please do email one of us using the information provided on screen. Okay. Danica, there's a couple of things that I sent to you via chat, which we will get to. And we have fairly substantial number of questions that we're going to field collectively. We have representatives from BJA both in the Policy and Programs Office, Danica and Maria, as well as Nikisha Love and Veronica Munson, who can help answer some of the fiscal questions, and we also have some additional Justice Center staff members here to help answer them as well. And it looks like we have some really great and very thoughtful questions that have come in. Okay, first question is budget related. Will we need to do a 2-year budget or 2 one-year budgets? So this is a BJA question.
Okay, hi, this is Nikisha. No, it would just be one budget, which will be cumulative for, if you apply for Category 1, then that will be for the 24 months, Category 2, which would be for 36 months, and Category 3, which would be for 24 months.
Great. Thanks, Nikisha. Are the 2 required educational sessions supposed to be budgeted in each of the 2 years, or is the orientation session to occur in year 1 while the BJA meeting to occur in year 2?
So I had mentioned this in my presentation, but both are going to be held within year 1 for fiscal year 2015.
And we typically, just as a heads up, usually do the events back to back, although we do ask you, because we have that planning that happens in advance, to make sure that you budget for 2 separate events. Also, I think on one of the slides, it said that only Category 2 and 3 grantees need to budget for the conference portion, and actually that was a typo in the slide. It's also Category 1 as well. Okay, Nikisha, this is going to be a question for you. Since a vehicle is an unallowable cost, how about operational costs for a vehicle that an applicant agency may already have but needs assistance with operating the vehicle?
Okay. Are they speaking in reference to having the vehicle fixed?
I'm going to guess for some of these programs, I'm going to try and be a mind reader here, that they use this vehicle to transport clients back and forth to services potentially, or maybe in between corrections institutions, but basically usually taking clients to appointments or that type of thing is what I'm guessing, mind reading. So basically they use the vehicle to help with the operations or the services.
Okay, I will have to look a little bit more into it.
Yeah, I was going to say, if you need to table that, we can, okay, perfect. I don't know, this is a collective question. I think this is more for Danica. I don't know if you can answer this, but let's try. What are the criteria that defines an entity as ineligible to apply?
So any entity that is not a state, local, or tribal government entity. So that would be everyone who does not fall into that category would not be eligible to apply. Or, you know, as I went over at the beginning of the presentation, designated mental health providers for the county as the designated county provider would also be eligible. But that's the only exception to strictly being a state, local, or tribal government entity.
Okay, get comfortable saying that because there's a couple more that are going to be a few different permutations of that answer. Okay, we have many service providers whose participants could be referred to. Okay, so there are many service providers they can refer their participants to. Do we need to provide a license for every service provider that could potentially receive a referral, or only for the main mental health agency that would be the focus of this grant?
So it depends on how they're structuring their collaboration. So there has to be a partnership between agencies. So it would be the agency information that, you know, because they're not partnering with all of these individuals individually. There's an overarching agency that they need to include information on, if that makes sense, if I'm understanding that question correctly.
Okay, and we do understand that some of these questions are a little bit complicated for this small little Q&A chat function. If your question's not answered, please do go ahead and feel free to send them to either me or Jerry, and we can route them to the appropriate person at BJA and get your question more thoroughly answered. Okay, our program received JMHCP funding in 2009. In 2011, solicitations were not open for us to apply for expansion. We applied for expansion in 2013 and didn't receive it, but we maintained the service on minimal funding. Can we apply for expansion funding?
If they are actually expanding their program, so there needs to be an expansion component to their program. If they've already implemented different facets of an expansion, then they would need to do something additional. So there has to be something that they're proposing to do that they have not yet done. And sometimes that's just, you know, expanding the number of individuals that they're able to receive. So building capacity to expand their program that way. So there does need to be some kind of expansion, though. If it's already been done, yeah.
Or I would say maybe in this case, if they are paying for a half-time case manager, for example, and they would like to make that person full-time and add another person on, is that an allowable use? Yep.
Yeah.
Okay.
Yeah. That's
okay.
That's an expansion. Yeah.
Okay. The application states that MOAs and letters of commitment are required. What's the difference between the two? Also, what MOAs are required at the time of application as opposed to what could be developed during the planning phase, which I think is an excellent question.
Agreed. So for our intents and purposes, there's no distinction. What we're trying to capture is that there is documentation of the relationship and a solidified agreement between the agencies of what that will entail, what the different relationships will be. and what the agreement contains. So whether you call that a memorandum of agreement or of understanding or you know, whatever you want to call that is fine. It's more important to have that documentation. So it depends on what you're doing. I would say, depending on, obviously, if you're expansion, you'll want to have that in place already. If you are planning an implementation applicant, I would say that you at least have documentation that the individuals are willing to enter into this process. So if you are, I'm just going to give an example. Let's say you want to start a mental health court in your jurisdiction and you haven't taken any steps yet. Well, I would say that you at least need to identify who your key partners are going to be and make sure that you have their buy-in for being a part of this process and committing to the initial stages. So, you know, that would be the way that you would capture and document that agreement and understanding. So basically what we're trying to make sure that you have, you know, firm, clear understanding between the parties. Because sometimes what happens is that folks will apply and then maybe leadership will change or the individual they were talking to at one agency no longer works there and the partnership falls apart. The collaboration doesn't really exist because they don't have anything in writing. They don't have any clear understanding other than perhaps some verbal or email back and forth. So by requiring you to have this in writing, have some kind of agreement or understanding, what that does is just ensure that and portray that your collaboration is in place and that there is a relationship that's been established. If that makes sense.
Yep, and just to piggyback off of that, Danica, I think there's going to be a certain level of technical, logistical things that happen within your actual grant that you're going to define and have come up during the actual planning process that we understand, and I think BJ understands, can't actually be in an MOA or a letter of understanding between partners. Yeah. So I think it's really more about that you have a partner that's willing to do and go through the planning with you and be your actual partner throughout the planning and implementation of the project versus what the very specific duties are that you might not be able to outline right now because you still have to plan the actual initiative.
Perfect.
Yep. Great. Okay, here we go one more time, back to applicants. So for crystal clear clarification, and this was written right after that slide, a mental health agency could not be the primary applicant for this grant?
They can be the primary applicant for this grant if they are designated as, they are either the county provider, so either they are already a state, local, or tribal entity, or if they're not, that they're designated as such. So it's common in counties for a nonprofit organization to be the county designated treatment provider. And if that's the case, that's fine. They're not a government entity as long as they have that official designation from the county.
Okay.
So they can be the applicant as long as they are a government entity already, so such and such county mental health, you know, or if they are a non-government entity that is designated as the county, state, or tribal treatment provider.
So any other questions that come in about this, we're going to direct everybody to contact us offline. So I'm going to skip over any.
I think we made it pretty clear, hopefully.
Yep. So if it's still not clear to you, please do contact us, one of us directly, and we can walk through with you the specific example. Okay. The next question is probably the most popular question that we get both before the applicants are done and then the thing that we go back and forth with BJA on virtually for every grantee. Can you talk more about the nonviolent offense definition? So Danica, I'll field this one.
Yep.
So MIOCRA, to everyone's chagrin, I suppose, does not very specifically give you a list of specific definitions of what that is. So it doesn't say assault, rape, arson, or any specific charge that's constituted violent or nonviolent. it is on the vague side. So the direction that we have received and what we counsel you to do is take a look at your state statute and see whether or not your state statute defines the specific charges in your penal law code as violent or nonviolent. We can send out references to that, but if you Google the New York State Penal Law Code, for example, and you look at the specific misdemeanor and felony charges, not only do they have a classification of A, B, C, D, or E, but then they also classify them as violent or nonviolent, or the majority of them, and that's where you should look to define whether or not a charge is violent or nonviolent. However, a vast majority of states and local jurisdictions do not do that and do not define it in their state statute. At that point, we then consult you to look to your state or district attorney for what they personally, within your jurisdiction, decide is considered a violent or nonviolent offense. Any questions outside of that, we'd be more than happy to answer, but there isn't anything else more specific there. Basically, the bottom line is your state or district attorney gets to decide basically the risk of what they're most comfortable with in the absence of any other specific criteria. Danica, anything else?
Cynthia, I would just add, refer people to page 12 of the solicitation. At the bottom of the page, it states that per MIOCRA, a nonviolent offense is an offense that does not have as an element the use, attempted use, or threatened use of physical force against the person or property of another, or is not a felony that by its nature involves a substantial risk that physical force against the person or property of another may be used in the course of committing the offense. So you can also furnish your district attorney with that definition if there's any question on your part about what constitutes a nonviolent offense. Like Cynthia advised, they can help you determine how your jurisdiction or state defines the offense at hand.
And one other thing that was on Danica's slide that you'll also see at the bottom of that on the solicitation, this is relating to the charge that they're coming into your program on, not their past charges. So it's not their criminal history or whether or not they've had a criminal violent offense in their criminal history. That's always also a really popular question. Okay. This is a little bit of a vague question. So Danica, let's see if we can run with this a little bit, and then we can always speak with the person offline. Can we create a resource that also serves people other than the target population? I'm going to guess here and say that maybe it could be something that serves the target population and the rest of the community, which I'm going to say is probably something that you would prefer, but I'm just curious your response to that.
Yeah, I mean, I think that we've seen that in different contexts. So, for example, we've seen different treatment programs that they may blend funding to engage different populations. For example, I know, going back to the last question, some grantees have, gotten around the violent offender exclusion by using other grant monies or other sources of funding to fund individuals that could not have been funded by the JMHCP program, who may have committed a violent offense, for example. So in that sense, yes, you certainly can have a resource that serves other populations of people, but you just must be careful that the money that you are using from these funds is only going towards those individuals who are eligible per page 12 of the solicitation, so per that violent offender definition, as well as being diagnosed with a mental illness or co-occurring and mental health and substance use disorder, those being the critical criteria for use of JMHCP funds. So that's really the most important thing, yeah.
I would add to that also, for example, from some of the programs we've worked with, if you want to talk practically about a tangible resource, we have had programs create state-level agencies that have applied, create operations manuals for community-based providers on how they roll out different evidence-based practices. So it's a state-level checklist, for example. And they roll it out to a couple of counties that are funded under JMHCP, but that resource will be intended to be rolled out statewide and will obviously benefit other target populations than that was intended in the actual application in the grant narrative. So it could, I would say, be something like that as well that has applicability to a lot of other people above and beyond who is being served in your grant. Okay, next question, do you have a guide format? And I think this is referring to the Planning and Implementation Guide, and just a couple of things about that. Within the solicitation, I don't have the page number off the top of my head, but I will look for it. At the bottom of the page in the footnotes, there is a link to the Planning and Implementation Guide that takes you to a sample PDF document, I believe either on ours or BJA's website. The P&I guide that you see there is actually in the process of being updated, so it's going to be a little bit more streamlined and a little bit less labor intensive in terms of writing for you as the grantee. It will contain a lot more things like checklists and shorter answers for you. It appears on page 14 in the footnotes of the actual solicitation. It's footnote number 5. So please use that guide as just a sample of the types of things that we're going to be asking you as the technical assistance provider as you go through the planning and into your implementation stage. Also for Category 1 recipients or people that are applying under Category 1, it's a very different structured type of grant, and we are creating a completely different P&I guide for that category. Unfortunately, we don't have that to link you to yet, but will be forthcoming. But if you take a look at the sample P&I guide that you see in the application, you'll see a kind of flavor of the type of questions that we will go through with you. Okay. What sorts of expansions under Category 3 have been most successful in the past? Which I think is a great question.
Cynthia, I'm going to let you answer that one.
Yeah, I was going to say, I figured, Danica, you're going to want me to answer that one. I'm not going to say what's been successful because I think successful is a wishy-washy kind of parameter of how you define success, but I'll tell you a little bit about some of the expansion grants that have been funded, the types of them, and this piggybacks off of, I think, the grantee that asked earlier, or a past grantee that asked earlier, can we apply for expansion funding again? Frequently, we'll have grantees that have been operating traditional substance abuse programs, so like a drug court, for example, or a community-based program that's targeting substance abuse, and they realize, gee, we have a lot of people here who have pretty serious and intense mental health issues that we're not entirely sure how to deal with. We'd like to layer on case management support. We'd like to look at different evidence-based practices specific for a mental health population or a co-occurring population. And those grantees tend to apply for expansion grants. We'll also see expansion grants that were, for example, same kind of thing, a drug court, for example, that wants to expand their population to a mental health court, or a grantee that is doing one specific evidence-based practice and has worked with one small population that they would like to open up and have be specific to a different kind of target population. So, for example, they may have targeted specifically men with some type of mental disorder, but now they're thinking they would really like to expand their target population to something that's gender specific or trauma-informed care or something like that. So those are the grants that we see that are pretty successful. I have another TA coordinator sitting next to me. She's nodding. So yeah. Okay, this is I'm not sure who this question is for. This may be a Nikisha question. This may be a Danica question. Is a letter from the SSA required to be submitted with the application, or is our assurance of coordination in the mandatory certification and coordination requirement form sufficient? Don't know if you guys can answer that or if we have to get back to the person. And I can read that again if you need help.
I don't believe we have a separate requirement for a letter from the FSA. So yeah, I'm just looking at the solicitation now, but because we do not explicitly state that, so I know that we don't require that. Yeah, the mandatory certification requirements and coordination requirement form, that really should take care of that requirement. And I'm just trying to find the page number for that, and that should be pretty explicit.
We can come back to that if that's helpful.
Yeah, of course, you know, when you're looking for something, you can never find it, but yeah.
Yeah. Why don't we come back to that?
Okay.
Once again, we encourage people, if your question's not answered, please do go ahead and contact us directly, and we can try and answer your questions offline. What if our state has out-of-state travel issues?
I don't know what that means.
I think this means we frequently run into grantees need to get approval for their travel from their local jurisdiction prior to actually traveling. We've run up against this frequently with the approval for the conference, Danica, where they need at least 30 days or 45 days.
Mm-hmm.
I think that's what this is referring to. So I'm going to just blanket say that we usually try to get the approvals done with enough leeway that you guys can put in whatever your application is for out-of-state stuff.
Right, but also I will say, you know, for some, I remember past events where a grantee was from a state where they had put a ban on travel on outside of the state. And because this is a requirement of the grant program, so that when you accept the award, you accept the obligation that you will be meeting this requirement, that's how she was able to get around the state limitation. So this, I would just reiterate that this is a requirement. We do usually, like Cynthia said, give plenty of time to request any kinds of approvals. That's a common, I think, experience for a lot of our grantees. But we really do require your attendance as part of accepting this award.
Great. I'm going to jump to a kind of technical about the attachments question. This person took out a very thorough question, which was great. They had a few technical questions about the process of submitting attachments. Are attachments required to have a specific name format, and or are they supposed to be numbered in a specific order? And you mentioned attachment number. Yep. Okay.
I would just say it is so very helpful if you just label it. I think that this is in the solicitation, but if you label the document or the attachment what it is. So if it's the abstract, label it as program abstract. And if you want to put your, identify acronym or name or whatever in there with it, that's fine. But as long as we know what the document, what the attachment contains, I think that's the most helpful thing you can do. But in terms of the order, that's not important. It's just more important that you label what the attachment is.
Yeah, and she further asked just about where to put things. So like, for example, there's a narrative attachment section and budget narrative section, but then I would assume all the other attachments go in under other attachments such as abstract, budget detail, workshop, and worksheet, and so forth.
Yeah.
It sounds like they could group together some of the budget things, but like you're saying, just make sure that everything is labeled correctly so you guys know what everything is.
Yeah, yep. And I would say, too, I would stay away from grouping things together, like in one big document. Do individual attachments for things.
Perfect. For the staff attending the orientation meeting, should that include the evaluator data staff person, too? I'd be happy to answer this one. The answer is maybe. Actually, it depends on what the actual major operations people are that are going to be working on your grant from a day-to-day purpose. What it says, I believe, in the solicitation is that we encourage you to bring a criminal justice person, a mental health person, and a finance person. Your fourth person could be anybody, really, and your technical assistance coordinator will work with you on choosing who that person is once you're awarded the grant. So when you figure out who the main people are that are going to be working day-to-day, that makes sense. For them to come, I'm not going to say that your evaluator shouldn't come, but it might be that your evaluator is going to hear or be familiar already with a lot of the research that we're going to be presenting, and we want to make sure that this stuff that happens at our orientation and conference gets out to the field who might not otherwise have access to attending these types of conferences. So that's just something for you to think about. I don't believe that The requirements in the application state that you have to say who the people are, just the number. So you can figure out who they are later on with your technical assistance coordinator.
Cynthia, can we come back to the mandatory certification requirements
Sure.
question? Because I found it in the solicitation, so I just want to revisit. I think the question was whether there has to be a separate certification from the SSA, and the answer is no. So in the solicitation, it says the applicants must certify that any treatment program proposed in the application is clinically appropriate, will provide comprehensive treatment, and has been developed in coordination with the SSA for substance abuse services. So there doesn't need to be additional documentation from the SSA. It just, the certification that you do provide has to include that statement that it was developed in coordination with the SSA. I think that answers that question.
Perfect.
Yeah.
I have a couple more questions that sort of have to do with applicants that are a little bit different and I think are some good examples.
Okay.
While we have a contracted mental health provider, if we were awarded a grant, we would conduct bidding process to select a mental health vendor to provide additional programming. In this circumstance, how do we address the MOU and license requirement at the time of application?
I don't know that we've come across this before. Cynthia, is this something that you've seen?
I don't know how to answer that one. I can't think of any grantees recently that I've worked with that have done some kind of a bidding process for a mental health provider in addition to who their contracted person is. Alex is next to me.
Okay, maybe we'll have to work this one out offline.
Offline, yep.
Yeah.
Danica, I don't know if you have this off the top of your head. I can look this up. I have it roughly. Could you provide us with data, please, on how many applicants approximately there were last year and the final number of projects that were funded last year?
I think there were about somewhere around 250 applicants last year, and we funded about 34 applications. Actually, I should say, let me actually amend that to say the applicants from last year were actually the applicants from 2013. So we did not put this solicitation out on the street last year because we had so many applicants from the previous year who were very high scoring and remained unfunded. So we funded about the same number in fiscal year 13 as we did in 14. So rather than put the solicitation out last year and go through the whole process, we just went down the list and chose those applicants who remained unfunded who also had very high scoring, well qualified applicants. So that said, it shouldn't be very far off from what we expect this year in terms of total numbers.
And what probably everybody wants to know is, yes, JMHCP is highly, highly competitive. Pretty much every year they fund about 23–25% of the applicants that apply based off of the approximate.
No, I think it's more like 13% actually.
Oh no, you're
year.
Right. You're right. You're right because I'm doing it off of the two combined. It's less than that. It's less than 20% of the applicants that apply. And not to scare anybody, but based on the attendance of this webinar that we've had today. And we also had a webinar last week that was specific to law enforcement agencies that are interested in applying, which if you did not actually attend that webinar, I would encourage you to look on our website for the archive, which is already there, and that has specific questions to different law enforcement initiatives. We've had close to 400 people just listen to these two webinars alone, so that would be, uniquely, potentially 400 different jurisdictions. So we're having an enormous amount of interest this year. Okay. It looks like, give me 1 second, I'm at that scrolling place. This is another example of who can apply. Our local behavioral health department contracts for the mental health services that are used in our collaborative courts. That's a very common scenario. Is this contracted vendor eligible to apply as the lead applicant?
Only if they meet the eligibility requirements.
Okay. Again, I'm going to refer you guys to, please contact us if that's not a clear enough answer.
So they have to be either, if the treatment provider is going to be the applicant, they must be either a unit of state, local, or tribal government, so government entity, or be the designated treatment provider for a government entity and designated as such.
Okay. The next question is a great question. I'll be applying as a designated mental health care provider. Our service spans across 3 states and 7 counties. Would you recommend that our application focus on the county where we are located or the entire service area?
I think it depends on where you're drawing your population from, your target population from. Wouldn't you agree, Cynthia, and who it is you're trying to serve?
Yep, I would. And hold on one second. Okay, sorry, just some background noise in our room. I think that with a number of projects that we have that have been funded and are looking at very, very large geographical areas, I think I would just caution folks to remember that $250,000, depending on how big your geographic area is and the amount of staffing that you're hoping to support and services, might not go very, very far. So I would think really, really, really carefully about just how big your service area is and the target population and how many people you're thinking about serving. If our jurisdiction receives JAG grant funds, direct allocation from BJA, are we still eligible to apply for JMHCP funds?
Yes.
Yes. Okay, target population question. Does the person have to have a mental health diagnosis, or can they have symptoms without diagnosis? Yes.
Yes, they can have symptoms without a diagnosis.
Yes. And that gets to some questions about eligibility and who the clients are that you're serving, and going back to the priority the emphasis on the mental health or co-occurring disorders. So the clients that ultimately you want to be serving in this program have a diagnosable mental illness or a co-occurring substance abuse disorder. They're going to come to you with some kind of symptom, and you're going to do some kind of screening and assessment, but ultimately the people we would like you to be serving are the people that actually have a diagnosis.
Right, but if you're talking about programs like, you know, law enforcement programs like co-responder programs or CIT programs, clearly you're not going to have a diagnosis going into crisis-type situations and funding those sorts of programs. So, you know, that being obviously a different variety than a treatment program per se, but right. But if you're talking about providing treatment services, clearly you'd want a diagnosis then.
Okay. This is a law enforcement question, target population. So I think it might be actually more general. We're looking to divert to mental health professionals at the 911 level prior to law enforcement intervention. Does that mean there could be facing charges, since the whole point of the project is to divert away from law enforcement to prevent jail?
Mm-hmm.
So,
yeah, I think that would definitely qualify.
For Category 2, how detailed does the already initiated strategic plan need to be for the planning portion? Can developing a more comprehensive strategic plan be done during the planning period if only initial discussion among top collaborators has begun? I would say absolutely.
Yeah, I defer to you on that one, Cynthia.
Yeah, I would say absolutely, and that's actually one of the things that we would work with you on in terms of technical assistance. As far as strategic plans, in quotes, there are a whole lot of different types of needs assessments, mappings, ways that you can design these programs that are, you know, tried and true examples within the criminal justice and mental health fields that we can give you examples of and help walk you through what that looks like. Aside from juvenile and adult individuals with a mental illness with a nonviolent offense, are there any other criteria for target populations?
Yes, well, I just want to go back to the place where that is mentioned in the solicitation to be able to refer people to target population requirements. So that is on page 12, at the bottom of page 12. So I know that, it does say has been diagnosed, as we just said, obviously when you're dealing with something like CIT programs where you don't know the individual's, first responder type programs, clearly you won't have a diagnosis, but otherwise the requirements are laid out right there at the bottom of page 12. So it's the mental health and or co-occurring substance use disorder, as well as the facing or could face criminal charges for nonviolent offense.
Okay, this is a great question. Are there any limitations on the ability of a state agency to apply for funding and then use the planning period to develop program models, identify needs and system capabilities, and then craft an RFP to select and contract with local service providers to implement diversion programming?
Yeah, I think that's one of those that's a similar question to the one that we received before, and that's something that we're going to have to tackle offline. I think I would need to run that past our general counsel's office. Generally speaking, we do require that collaboration be in place already. So I can't say definitively right now. We haven't ever funded anything like that, but we could certainly follow up and get an answer for that.
This is a similar expansion grant, another expansion grant question that's similar. If we apply for an expansion grant, can we ask to continue to fund a position that was started under the current implementation grant co-responder, while also expanding additional services under the new grant proposal of second co-responder, additional CIT training, etc.? That sounds like yes.
Yeah.
Jerry's shaking his head at me too. Okay. In regards to eligibility, I work for a substance abuse and mental health managing entity that contracts with the state for the administration of state and federal funds in 5 counties. We do not provide direct services. Would we still be eligible to apply? Do you need to see that in writing?
I'm thinking that through. So they're not the service provider. They're the mental health, and they're not a direct agency. I guess they contract out. I think so. I think I need to know a little bit more about what their role is, but I think the larger question here would be, I would make sure that they're not the applicant, that the state or the locality, because I think that's a little bit more of a difficult question to answer. But in terms of being a mental health agency for the purposes, I'm just reviewing the eligibility criteria. Well, it says that they have to be responsible for mental health services. So it sounds like that's what this entity is, that they are responsible even though they're not a direct service provider. It doesn't state that they have to be a direct service provider, but that they have to be responsible for those services. So in that case, I think they would be if they are responsible for mental health services.
Okay.
And that's the language that's on the front page of the solicitation that's in the authorizing legislation, and how a mental health agency is defined. That's what I'm referring to.
We have about 5 minutes left. I'm going to try and cover some questions that are outside of what we have covered already, but we still have a lot of questions left that I don't think have been answered. Once again, we encourage you to please contact us if there's something that you obviously need an answer on, and we will get that question answered for you. Does the budgeted match need to come exclusively from the entity applying, or can it be collective with all agencies involved?
Yeah, there's no limitation on that.
Yeah, people do
come from different sources. It doesn't have to be as long as it's it's meeting the requirements in terms of it's not supplanting.
Yep. In Category 2 grant, how long is the typical planning process to gather data before moving to implementation? If you don't mind, I want to answer that one, Danica. One of the decisions that were made this year to extend the Category 2 grant from 24 months to 36 was specifically about this question. Grantees found that what was originally a 6-month planning process really took a lot longer before a real, quote, implementation started. And frequently with a lot of programs, there's not an actual implementation start date, like we're kicking things off on July 1st. It tends to be a little bit rolling in terms of some of the services, when staffing happens, when hiring happens, when budgets are approved. I don't know that there's really a definitive, the planning period ends and then you start implementing something. Yes, with a mental health court, for example, there might be an official open date, but you're still doing policies and procedures and all of those things there are happening beforehand. And I would even venture to say that frequently once you get into implementation, there is a period of time where we work with you on revising some of the policies and procedures that you thought were going to work until you actually saw the people in front of you. So I would say minimally 6 months up to a year. It depends really on what kind of infrastructure you have in place already, how collaborative your partners actually are, if you're able to get meetings and discussions on the books quickly, how efficient your meetings are when you have them, and what that all looks like. So I would say minimally 6 months. It could be longer than that. Danica, this is a Category 1 question that I don't think we can answer. Can you only apply for jail populations, or are detention centers for juveniles also allowable?
Oh, we have not discussed that. I think we just need to discuss that offline.
Okay. Are courts eligible applicants or only executive branch agencies?
No, courts are totally eligible applicants. So the category is broad when we talk about state, local, or tribal government entities. I mean, that can include courts. There's no restriction in terms of, you know, executive versus non.
Okay. And then make sure everyone gets this clarification. The grant amounts for the 24 and 36 months are for the entire duration of the award. So no, $200,000 is not awarded in year 1 and then in year 2 for a total of $400,000. It is a total of $200,000 for 2 years, and a total of $250,000 for 3 years, and a total of $150,000 for it's Category 1, Danica, is 2 years, 24 months.
Yes.
Yeah. Yep, for 24 months. So it's not per year. Give me one more second. I'm trying to find the last couple of questions that are fast. For Category 3 applicants, is this only for agencies that are receiving grant funds and want to expand, or agencies that have existing services but want to expand on their current services? It's for both. So if you want to expand something from scratch, if you have existing services and want to layer on, those are all allowable. And I think this is going to be one of our last questions. There's still at least a dozen or so more. Again, please contact one of the people that's on the screen. Do our screening and risk assessment tools need to mirror the resources mentioned in the application, or do they just need to be demonstrated as evidence-based? No, they do not need to mirror what is actually in the application. They do need to mostly be evidence-based. And that's actually something that we will work with you on as the technical assistance provider, and that you will sort of get to hear from us over and over and over and over again all about screening and assessment. So loosely for your application, you do want to call attention to the fact that you want to do screening and assessment, because some jurisdictions haven't even gotten that far. And we'll be very pleased to see that you're being thoughtful and thinking about that specifically. And obviously we can get into further conversations with you about how those instruments are normed and validated on your population, if you have the money to do those types of things, or not if you don't. So that's the fast way for us to answer that question. Once again, please do contact one of the people on the screen if your question was not answered. And we will be posting the webinar of this recording and the PowerPoint slides up on our website in the next few days. This concludes the Justice and Mental Health Collaboration Program 2015 Grant Application Assistance webinar. Thank you all for your attendance and participation, and thank you to our presenters. Danica, thank you so very much. We're looking forward to working with all of you. As you exit this webinar, a short survey will automatically appear to ask about your experience on the webinar. We're required to report on participant responses to this sort of programming and very much appreciate your taking a couple of seconds to complete the questions that will appear. We will email a copy of this recording of the presentation out after the event, and it will also be available on our website. Thank you so much.